I will be referring today to challenges to combination HIV prevention in the context of a pandemic in Latin America and the Caribbean. This is based on combination HIV prevention. It's necessary to consider the three pillars. Just dealing with or addressing the biomedical pillar, having policies and services, is not enough to be able to put an end to the new infections. It's necessary to mention the structural component, discrimination, policies within human rights framework, and that's important for the behavioral aspect for the individual, where he chooses freely based on formation and education. Within the biomedical component, I wanted to highlight that besides antiretroviral treatment like TAR or multi-month delivery will not be dealt with today. Talking about some aspects of the epidemiological aspect of HIV infection, the new infections show a descending curve, but in Latin America, the new infections between 2010 and now, in the Caribbean, the reduction is even higher, but less than at global level. So we are a little behind in all this. We're falling behind. We can talk about the antiretroviral treatment led by Latin America and Caribbean at a global level. But currently, the data from 2020 show how globally 73% of people with HIV had ART treatment, but less than 70% of people within the region were receiving antiretroviral treatment. One of the aspects of the impact of COVID is seen in the results of the Pulse survey that was done by the World Health Organization. What happened with the essential services for transmissible disease. Here are the ones with greater interruption: diagnosis and treatment of tuberculosis, followed by services of prevention for HIV. Also were impacted clearly the services of testing for HIV and treatment, antiretroviral treatment. Basically, the testing, screening, and diagnosis of HIV, we can see that since 2019 to 2020, there was a reduction of 34% in the number of HIV testing in Latin America and Caribbean. This has to do with 20 countries in the area at Latin America and Caribbean. Clearly, the reduction in screening that is also observed in a reduction in screening that had a lesser reduction, but 27% in a reduction of coverage of testing in pregnant women. This also has an impact in a reduction of the diagnosis of people with HIV. And this between 2019 2020, the reduction was 27% in the number of tests with positive results in our region, our area. As far as PrEP, a tool or an option additional for prevention, people with at high risk of HIV as part of this combination HIV prevention, this is going slow. The recommendation for WHO in 2015 and 2017, there was one country with PrEP implemented as a policy, as a health policy. In 2019, there were 8 countries implemented PrEP as a policy, and currently in 2021, we have 10 countries that have adopted PrEP as a health policy to prevent HIV. There are more countries offering PrEP as part of projects or are planning policies or projects. But in spite of seeing a growth, the growth is very slow. As to the number of people that receive PrEP in Latin America and Caribbean, we have seen a growth in 2019 to 2020 of 19,700 people in PrEP to 34,000 in PrEP. We have the data the first semester 2021, but they are not complete. It's just 10 countries have reported their information to us. So most of the people in PrEP in this region come from Nasir. That's we can see in 2020 there were 23,000 in Brazil, followed by Haiti. So the coverage of PrEP and the offering of PrEP in the region is at levels that are insufficient to respond to the need. Regarding PEP, policies also have an impact here. Countries of the region offer PEP, which is post-exposure prophylaxis. This is also a very good entry to receive services to prevent HIV, and it's recommended when there's professional exposure, occupational, let's say, case of rapes or sexual assault, but it's also recommended for exposures due to consensual sexual relationships. This is where we have the biggest gap. Only half of the countries reported, 27 out of 33 countries offer PEP in the case of exposure due to consensual sexual relationship. During the COVID pandemic last year, out of these 17, 6 countries indicated that these services were discontinued due to the pandemic. More strategies for combined prevention. These are both, this is self-testing and assisted notification, HIV partner notification. This is part of an additional approach as testing biomedical components for prevention. We have seen that countries also are very cautiously increasing incorporating these strategies. Self-testing in 2019, there were only 2 countries that had adopted it as a national policy, Brazil and the United States. In 2020, a total of 7 countries were added. So also due to COVID pandemic. And as to assisted HIV partner notification, there's 3 countries that are offering this, 17 countries. What we see here are strategies that are recommended, and we know that they're effective. And in response to HIV, we still have a very slow incorporation as a package to respond to HIV. Condoms are still an important tool in preventing HIV. During these years of pandemic, the median or average distribution of condoms have reduced 27%. If we look to the right, the image, one country to country, the number of condoms, the percentage change of distribution of condoms, one country to another, 2019 to 2020, we can see that in every country except one, there was a reduction in the distribution of the number of condoms. What we see here are the aggregate values and the prevention cascade of HIV in Latin America that developed these cascades in 2019. In the first pillar, we see the total of population estimated, or HSH, M2M, and MSM with zero, separated by 0 status, and we see that the negative MSM had been screened with HIV tests in the past 12 months. However, only 17% of those estimated had been linked to these, so they had received a series of services that were more comprehensive based on their needs. And only 12,000, so 6% of the total, had continued follow-up in 12 months. So they had gone back within 12 months to get another test, another screening test for HIV. The recommendation of WHO for this population is to have HIV testing between 6 to 12 months, maximum 12 months. So something is wrong in this sense. Out of these 12,000 people, or 2% or 2.3% were positive when previously these people had been negative. So this kind of analysis allows us to see what the reach is for our services. 40% in the past 12 months is not bad, but the coverage of services of higher quality, comprehensive and follow-up of these shows larger gaps, and we have important gaps in the impact of these services, as we see here, unfortunately, people who were negative and now are positive. For sex workers, we see results here indicating a similar outlook. As to stigma and discrimination, we see that unfortunately a very high number of people of key populations avoid going to health services to get health services. Here we see MSM and others who sex workers who did not go in the past 12 months, 50-60%, almost 30% of the sex workers in Barbados, close to 47% of sex workers in Dominican Republic avoided going to health services for aspects related to stigma, discrimination, and treatment in those sites. We see also how people who were denied health services in the past 12 months, transgender women, MSM, or sex workers, or HIV. The very few countries that have information. This information is essential to be able to monitor. One of the elements to be able to monitor the actions in reduction of stigma and discrimination in health services. Almost at the end now, we see that during this COVID era, there have been important improvements in essential services, redirection for mitigation programs, providing antiretrovirals, dispensing multi-month retrovirals, and also there were opportunities. In spite of the fact that there was a self-testing, that we saw that more countries had incorporated self-testing as a national policy, and I already mentioned the multi-month antiretroviral dispensing, monitoring, virtual monitoring to adherence, delivery of medications to the homes of the users through actions with the community, appointments online, telemedicine. Conclusions, we have to consider the trend in the epidemic, HIV epidemic, very favorable. The COVID pandemic has been a big setback in many levels and at the level of response. HIV, however, we've also seen some opportunities that are necessary to keep up and enlarge, expand. It's important to take into account the new paradigm for HIV prevention using comprehensive policies for prevention to see the person and all the needs they have, and also policies have to be aligned with international recommendations. Before the COVID pandemic, we still had a huge debt towards response to prevent HIV. COVID pandemic has been a big blow, but we have to catch up on lost time, and here's one of the guidelines that are necessary to be able to do it. It's also very important to have methods and analysis like the prevention cascade, and it's important to approach stigma and discrimination. So one of the essential issues is to ensure participation and with the key populations and those affected by HIV. Thank you very much. There's my email address. If you need to get into touch with me, I'm at your disposal.